Fox News alert for you now. The FDA just giving full approval to Pfizer's COVID vaccine. It's the first vaccine to get that full approval, and in record time, too. That has critics asking if the process was rushed. Was it? Well, let's bring in Admiral Brett Giroir, former Health and Human Services Assistant Secretary, and of course, he was our testing czar. So tell us a little bit, sir, about what this moment means to get full approval.
Well, this is a very big moment in Operation Warp Speed history and the history of our vaccines, our fight against the pandemic. Prior to this, we had emergency use authorization. What that really meant is that the public health benefits outweighed the known and potential harms. What this says today is we know the benefits, we know the harms, and this vaccine is safe and effective, and every confidence can be given to that. Americans should feel very good, even better than they did yesterday, about getting the vaccine.
Yeah, what took so long?
Well, it is a complicated process, and I know there are many, many good professionals, incredible professionals at the FDA. I was acting commissioner. It does take a while because all the data is looked at in detail. You know, every page is turned, the facilities are inspected. However, again, as I've said before, I think it's unconscionable that the Biden administration does not have an FDA commissioner even nominated to provide leadership. It might have been a little faster, but it is complicated. There's a lot of material, and Americans should feel very confident in the process.
Some have said that they were hesitant to get the vaccine and pointed to this lack of full approval. How do you think the administration and its goal to try to get more people vaccinated can utilize this news?
Well, I think the American people will utilize the news. The poll said about 30% of those who have not been vaccinated would become vaccinated, feel very confident about that once the vaccine received full approval. That just happened. The vaccine is fully approved, and I'm very hopeful that this will push people over the edge to go get the vaccine, because it is our best protection, aside from natural immunity, against all the hospitalizations and deaths, particularly that Delta is causing across the country.
Admiral, as you look down the road now with the FDA approval, and there's talk every day now about a booster shot requirement, how do you view that process today?
So I believe boosters will be authorized at some point by the FDA, hopefully soon. The data in Israel as well as data in here are clear that our vaccine immunity is very good, but it wanes over time. So after 5, 6, 7 months, our protection against infection, and particularly for those over 60, protection against hospitalization and death decreases. A booster shot, just like all your typical vaccines, you know, we give them very many months apart. We don't give them all in one little sequence. So a booster shot for COVID would be very similar to booster shots we get for other vaccines, and really has the potential to give many, many years of immunity. So it's not just the number, it's the spacing. So I'm very encouraged by the data out of Israel, even published this weekend, showing that that third shot is highly protective, particularly in those over 60.
Okay, so just help us understand this. So in order to get the approval, you need time to make sure that it works, right? Just like the 6-month Pfizer vaccine, let's say, followed by a booster, perhaps, if necessary. But there were Americans getting the vaccine last December. So that's a full 8-9 months ago from today. So at what point would Pfizer then understand and know whether or not a booster was necessary? Can you forecast that?
So Pfizer has been talking about waning immunity, and there's been many publications about waning immunity. But you have to have the time that goes by, and 6, 7, 8 months, this is the time where the immunity wanes. So you really have to wait that amount of time. And what we're seeing right now is it's not only waning immunity, but the vaccine is still effective against Delta, but it's not as effective against Delta as the other variants and the parent strain. So what we're seeing right now is because of diminished effectiveness against Delta and waning immunity, we're getting the cases. And that's why that third dose is going to be very important. It's already been authorized for the immunosuppressed, and I am pretty certain it's going to be authorized for at least people over 60, maybe over 50, within the next few weeks.
We know that the efficacy goes down maybe after 8 months, and especially for people over 60. What do we know about the lasting effects of natural immunity?
So natural immunity is very important, and there are still no data to suggest that vaccine immunity is better than natural immunity. I think both are highly protective. We do know, however, that even if you're naturally immune, a dose of vaccine can even raise that even further. But I think if you had proof of COVID infection, right now that's still equivalent to vaccine immunity. And even the CDC recognizes that if you're an American coming back to this country, if you've had a proof of a previous COVID infection, you don't even need to be tested. So I think when businesses reopen, they ought to consider natural immunity, vaccine immunity, or frequent testing, all equivalent to get you back in the workplace.
Okay.
I had one last quick thing, which is, some have suggested that, they like to go after big pharma, complain about big pharma and all of the profits, and that this is, suggesting a booster is just a way for them to make more money. How would you reply to that?
Look, I'm not going to defend big pharma except to say that they came to the rescue with a lot of government support here. The doses are $20 a dose. This is not very expensive. And the science clearly says this is not a pharma scheme. This is absolutely necessary to protect Americans. The first two doses, and now we see the third dose.
Okay. Last point on this whole booster thing. You're going to have some people who are going to run to their doctor to get the booster shot, right? I mean, we can agree on that. You're going to have somebody who's saying, man, you told me to get the vaccine. I got the vaccine. Now I got to go back again. I mean, from a medical standpoint, from a messaging standpoint, how do you communicate that to people? That this is the next step that you need to do to keep you and your family safe?
Well, I would just ask people to consider when they get their children vaccinated, they don't get all the vaccines in one little bunch. Same thing for HPV, same thing for hepatitis B. You actually have to get it over time. That months should pass and your immune system evolves its response, and when you get that boost, it's long lasting.
I see.
What we did here in the pandemic is we got everybody vaccinated to squelch the storm, the fire, but now we're looking for that long lasting immunity, and the boost will do that.